Your 8-month-old might be a talker or a babbler by now. A lot of them around this age are vocalizing two syllables, and you may actually hear them say their first word soon. I am Dr. Nkirika. I'm a pediatrician and pediatric ear doctor, and I'm also a mom of 3. Today, we are chatting about everything that's going on with your baby at 8 months old. Around this age, a lot of babies are vocalizing, saying two syllables, and you may start to hear things like bye-bye, dada, mama, cho-cho. This is because these are the words they're learning and the way their mouths are moving. So you must start to hear their first words soon. If your baby already say their first words, let me know in the comments what they actually said. If your baby has not, I don't want you to worry. Remember, babies are different. There is a wide range in ages of things they're expecting to do and say. So you should hang on. They will be saying their words or babbling or making noises, and they will be saying words soon. Things you can do around this time to help keep it fun, keep their development going, is using hard-covered books that are small with a lot of colors, a lot of objects, and you can actually read and point the objects and say it directly to them. You'll be surprised at the amount of knowledge they're acquiring, and before you know it, they will start to point and actually say those words new as they get older. Around 8 months old, you will also notice your baby having what we call reflexive or mostly solidarity cries, so which means they will notice another baby crying somewhere and they will join in the cry because they're trying to show empathy, so they end up crying with the baby. If you have twin babies, triplets, or multiples, you will tend to notice this more because you have other babies around, and you will notice one crying and the other one joining in, and they just have the whole solidarity cry. Around this age, babies are also getting very interested in what the other baby around them has. So for instance, for triplets and multiples, you will notice your baby one having a toy, but actually wanting what the sibling has. So end up having a lot of sibling squabbles because now they're wanting the toy the other person has and actually going and reaching out to get it. This is normal. This is a way of development. You may notice one baby doing it more than the other. It also depends on the baby's personality. So I wanted to give it some time. This is a way of development, the squabbles and the bickering, and babies just generally growing together. A baby, as regards movement and development, you may have a baby who is a sitter, who's attempting to crawl, a crawler, a cruiser, or maybe even one that's already starting to walk. Babies are going to vary as regards what they're doing, but if your baby is not making any attempts at sitting at this age, I actually want to follow up your regular pediatrician to make sure there's no developmental delays that need to be addressed. Every baby is not going to be crawling, but at this age, most babies are supposed to be sitting with and without support. If your baby is already a mover, they're going to be needing more attention now compared to before because they're going to the couches, to the kitchen, to the furniture, and they're more likely to pull on things that may hurt them. If you have not already, this is when you should highly consider baby-proofing the house. Please put a baby gate on the stairs to make sure your baby is not climbing upstairs or maybe trying to climb down and falling down the stairs. If you are able and have the space in the house, this is also when you can have a little bit of baby gate that guards off an area where your baby can play inside, have all the toys, and they don't have access to outside. But you are sure that every toy that's inside is big enough for them to play with and not small enough for them to put in their mouth. You want to get your kitchen cabinets baby-proofed and locked. The babies love the pots and the pans and everything underneath, but they also tend to get to places that have cleaners, spices, which they can easily get in their mouth and accidentally hurt themselves. If your baby is the one already fascinated about like pots and pans and spoons, you can place a few on the floor for them to play with. That way they don't have access to the ones that are already locked. So you can put a few on the floor, let them play with those, and then keep your kitchen cabinets locked. If you have not already, you also want to make sure there are no medications around, no medications left in the tabletop in the living room or even the countertop in the kitchen. Those little fingers are really fast, so they may not even necessarily be tall enough to reach them, but they can stretch their fingers because they see something on the counter that's colorful, and they always tend to want to reach and get hold of them. Things like colorful pill packs for grannies or parents who take medications or vitamins and things that are colorful are very fascinating to babies at this age. So even though they are not able to be tall enough to get them, they can cruise around and stretch their toes and their fingers and can easily get these medications. And those that are not well covered, they can easily pop into their mouth and may end up in the ER. These whole conversations can be stressful, but there is a lot to think about when your baby gets in the mood between the ages of 6, 8, and even 10 months. Around this age, your baby is a mover, so they're also prone to falling a lot. It may be falling when they try to hang on to something to cruise, or it may be falling when they climb the surface when no one is looking. I want to reassure you, a lot of these babies fall a lot, and some of them will bump their head. I have a whole previous video on head injuries in babies and kids that I want you to go watch, where I talk about head injuries in babies, when to be concerned, what to do, and when to talk to your regular provider or take them to the emergency department. Around this age, on a more positive note, a lot of babies are great sleepers or maybe good sleepers. They tend to sleep about 10 to 12 hours a night, so that means a whole night, especially when they have a feed just before that. If you are trying to get your baby into a good routine, you can establish from where you feed them, give them a cool bath, play a little bit with them, and try to put them down to sleep before they get tired at the same time of the night. This helps babies get their bodies into a routine, and at some point they actually establish that and start to sleep through the night. If you are struggling with this and struggling with sleep, and your baby is struggling with sleep, don't forget to talk with your regular provider who can refer you to a sleep specialist or have other recommendations for you on how you can navigate that. And finally, at this age, while you may think your baby is getting older and ready to be independent to move around, babies actually become clingy around the age of 8 months old compared to when I talked about it at 6 months old. Their separation anxiety may become worse now, which means you may move from one room to the other and they start crying and get fussy, thinking you left them. This is a time that you should give them some time and also give them some independence. If you notice them cruise and go into a different room, as long as it's a safe area, it's okay to let them be and let them come back out and find you. As much as I want you to be available for them when they need you, if they're in a safe area playing by themselves, you don't necessarily need to chase them. You want them to get used to not seeing you around so they can know that whenever they want you, they can also come and find you. Let them get fascinated. Let them get curious about the environment and explore the environment as long as it's safe. Let them get familiar with people around them and whoever they want to reach out to. When your baby is 6 and 7 months old, I talked about introducing semi-solid foods and how babies are probably doing great with it. But this is probably not true for every baby. If you're struggling with feeding your baby and they're not very excited about feeds or actually tolerating them well, here are a few tricks you might try. While you're setting your baby's food down and feeding them, give them their own spoon. Let them be able to dig into that. Even though the food doesn't go into their mouth, it may make them messy, but this gives them some sense of involvement of feeding themselves. So when you give them the spoon, they dig that in, actually take the other spoon you're feeding them with and still feed them while they're making a mess on the table. You can simulate a form of play while you're feeding them. Things like here comes the airplane, where you have the food and going in multiple areas before it goes into their mouth. And you can show them by going into your own mouth and then show them. Those kind of play and feeding actually gets babies and kids entertained, especially when it's repetitive. They tend to like that and enjoy feeding again. On another note, instead of attempting to feed them yourself, you can actually place the whole food on the clean high chair and let them grab it and put it in their mouth. Of course, you're not sure how much of this food is ever going to be able to get into their mouth or be enough for them, but have a backup of being able to feed them at the same time. This is just to allow them get used to the texture, get used to feeding themselves, and then actually involve in play while they eat. While all these are not going to work for every baby, you need to be patient when it comes to introducing semi-solids and feeding or flavors to your baby. And that's it for what to expect from your baby at 8 months old. From feeding to baby proofing to movers, I will see you for your baby at 9 months old.